Today I'm going to help you find your radial and carotid pulses so that when you're out doing your aerobic activity, you can track your heart rate even if you don't have an electronic heart rate monitor on hand. So we're going to start with finding your radial pulse. Now I should say you will need a watch for this so that you can track time. We're going to need about 15 seconds. And what we're going to do, I'm going to come right up here. We're going to take our hand. See that lovely set of tendons right there? We're going to go just to the thumb side of that. We're going to place our fingers gently. Right there next to your radius, you should feel a pulse. You may need to move your fingers around a little bit to find it, but your radial pulse is right there. So you're going to hold your fingers there and count the number of beats you feel for 15 seconds. And then you're going to multiply that by 4, and that is your heart rate in beats per minute. So then, to find our carotid pulse, we want to find our carotid arteries. We have 2. You can feel it on either side of your throat. And what we want to do is we're going to come down from the jaw. If you have an Adam's apple, it's really easy. You're going to go just to the side of it. And there's your pulse. Right there. Or right there. And depending on your structure physiologically, you can start by placing your fingers very gently. If you can't feel, press a little deeper. But if you press too hard, you'll occlude the blood vessel, and that's going to stop blood flow. You won't feel a pulse, or you won't feel a correct heart rate. So start as gently as you can, and if you need to press a little harder to make sure you feel your pulse, go for it. Now, once you've done that math or counted those beats, there's a couple of different ways you can do this. So if we have our 65 and 80% of estimated max heart rate, we can divide those numbers by 4 and give us the number of pulses and beats we should feel every 15 seconds when we're taking our heart rate. That way, when you're out running, you know, okay, I don't have to do math right away. I can just count pulses, and as long as I'm between those 2 numbers. So for my example, as a 29-year-old male, 124 beats a minute comes out to about 65% of my max heart rate. 153 beats a minute comes out to about 80%. A quarter of that is 31 beats a minute to 38 beats a minute. So as long as when I'm out doing my cardio, if I have to stop for 15 seconds to get a quick idea of where my pulse is at, all I have to do is count the beats, and I know, okay, if I'm between 31 and 38, I'm right on target. If I'm lower than that, I need to work harder. If I'm higher than that, maybe I need to ease off. That's how you find your radial and carotid pulses and use them to tell where you're at in terms of your heart rate. Have fun out there. Stay strong.